Will this work for you? Absolutely. So let's talk through some of the things that people worry about with hypopressives and worry that it might not work for them. So I'm 60 plus years old. It couldn't possibly work for me. I had my babies ages ago, or I've had pelvic floor dysfunction since my menopause. It's been 10 years, it's been 20 years, it's been 30 years. Hypopressives absolutely will work for you. I have had clients who are in their 60s, 80s. I've got one in her 90s, and they have all seen a massive difference in their symptoms, in their joie de vivre, and in their excitement for the future, now that their pelvic floor is starting to work well again. So the other question we get asked a lot, and I get asked a lot, is I have other limiting health challenges. So this might be chronic fatigue syndrome. This might be ankylosing spondylitis. This might be, there's so many, this might be ME, or this might be multiple sclerosis. This might be diabetes. It could be anything. There are contraindications in hypopressives, but on the whole, the lateral breath work and the poses can be done by everybody. The contraindication is sometimes for the apnea breath. But in the most part, hypopressives can be done in conjunction with other exercise programs and also in conjunction with whatever is going on in your body. Hypopressives bring a great sense of calm, they bring better resting tone, and they are great for helping almost everything, but especially your pelvic floor. Okay, so my doctor, my physio, my NHS consultant said that I perhaps can't do hypopressives. This is something that we can discuss with you, and we can see whether hypopressives are right for you. My doctor maybe said, you have a prolapse, there's nothing you can do about this. All you can do is use a pessary. You can use hypopressives alongside a pessary. You can use hypopressives to start improving your resting tone. Once the resting tone has been improved, then the ligaments in your body can start to remodel. Remodeling of the ligaments can take time, and that's why this is not a quick pill. This is something that takes 3 to 6 months of regular 10 minutes a day practice. Okay. Basically, from the age I've had young gymnasts who've come to see me who are 10, 11 years old with urinary incontinence, and they've been able to do hypopressives too. If you have a diastasis, you can do hypopressives. If you have mobility issues, so for example, if you can't get onto the floor or you can't move about a lot, then you can do hypopressives in a wheelchair. You can do hypopressives on a chair. I've worked with people who have been wheelchair bound. So there are options for everyone, and we try and make sure that we cover them in the courses.